Hi, this is Andrea Kane, and I'm here with you for HIT 452 Statistics and Data Analysis. We are still on week 5. This is the second lecture video for this week, where we are covering chapters 6 and 7. So this will be chapter 7, Hospital Autopsies and Autopsy Rates. Our unit objectives are the same as they have been all week, 9.5.1 through 9.5.13 and 9.7.1 through 9.7.8. If you want to follow along in your textbook, I'm on page 111. Our learning objectives according to the book this week are to identify alternate terms for autopsy, recognize a coroner's case and determine when it would be included in a hospital's autopsy rate, calculate the different autopsy rates that there are, because there are several, and then you'll be, again, utilizing Excel and completing spreadsheets. I think that'll come with your assignments. Right, so autopsy, what is that? It's the examination of a dead body to determine the cause of death. It's usually performed to educate physicians and allied health professionals as well as to answer questions from the family. An autopsy can be performed on the entire body or a particular body organ. Most hospitals no longer perform autopsies on site. They usually send them to major medical centers for that to occur. There was a time many years ago when hospital pathologists did autopsies, but now most bodies are sent out, like I said, to teaching hospitals, university hospital settings, that sort of thing. Other names for autopsy include necropsy and postmortem examination. They are generally conducted by a hospital pathologist. Occasionally, it may be by a physician on the medical staff who's been delegated the responsibility, but almost always it's a hospital pathologist. It is performed in the hospital morgue, although sometimes it can be in a specific room in or near the lab or adjacent to the morgue that's specifically for an autopsy. It's pretty rare that one gets performed at a funeral home, because typically they want to perform the autopsy before the body is released to the funeral home. Gross autopsy rate. This is the ratio during any given period of time of all inpatient autopsies as compared to all inpatient deaths. It's customarily reported as a percentage, and newborn autopsies are included in the gross rate. So if we look at page 113 in our book, example 7.2, toward the bottom of the page, not exercise 7.2, but example 7.2, shows you how to walk through doing that. It shows you not only for a gross, but also a net. And the net, again, pulls some cases out. Gross is everything, net pulls out. And what they pull out are unautopsied coroner's or medical examiner's case. Okay, excludes those coroner's or medical examiner's cases. There are certain types of deaths that are reported to the coroner or the medical examiner, depending on what is called in your state or area. A coroner is an official, elected or appointed. It can be a physician or it can be a non-physician that's responsible for determining the cause of death in an unattended, violent, or unexplained occurrence. Again, it doesn't have to be a physician, although it can be. I have worked with coroners and medical examiners who are physicians and also who are not physicians. Both are excellent to work with and know their information, but they come from a medical background. Obviously, they'd have to be able to understand. Obviously, if a body is released to the coroner or medical examiner, it's not available for autopsy by the hospital pathologist. That's why it's pulled out of the net. So gross means all autopsies, whether they were performed by a hospital pathologist or whether they were performed by the coroner or medical examiner. Net means you pull out those coroner cases or medical examiner cases because they are not related to what occurred there. Sometimes the coroner or medical examiner will do their autopsy at the hospital, I've seen that happen. I've also seen that the body can be removed somewhere else, like it can be to a funeral home or it can be to another location in the county if they have a specific room in a county building where these take place. It just depends. So looking at the net autopsy rate, again, example 7.2 toward the bottom of page 113 walks you through that. So you have hospital inpatient autopsies. This is a post-mortem exam performed in a hospital on the body of an inpatient who died during the hospitalization. A hospital autopsy is also a post-mortem examination, but it may or may it says wherever it's been performed. I can't imagine that it wouldn't be in the right place, but the body of the person has sometimes been a hospital patient. So this is for your outpatients and your ED patients. So inpatient was everything happened at the hospital. Hospital autopsy means that the autopsy may have been performed at the hospital, and it may have been performed on a patient that was in the ED or some other outpatient setting. Or it may be that they brought in a body of a former patient to be autopsied in the hospital. So you have all those different circumstances. So that's why inpatient does not equal hospital when you're talking autopsies. And this just goes through some of the steps. Fetal autopsies are not included in the hospital autopsy rate because the fetus, the stillborn child, is not considered a patient. So that's why it's not included in that rate. For all autopsies, there has to be a consent signed, usually by next of kin or executor of the estate. Next of kin is most frequently done because sometimes executor of estate has not been yet determined. The autopsy report has to be filed in the patient's health record, and there is a certain time frame for that. It's usually 90 days. Tissue specimens must be filed in the hospital lab along with the autopsy report. Adjusted hospital autopsy rate, obviously it's been adjusted. So it's a little bit different than a net. Adjusted hospital autopsy rates are very, very rarely reported. If you want to know how to do those, look at page 116 at example 7.3, and that'll walk you through how to calculate an adjusted hospital autopsy rate. And this just reminds you that it looks at the bodies that are available. Newborn autopsy rates. This is, again, focusing on newborns. If you look at page 118 in your book at example 7.4, it walks you through how to calculate this. Again, another really easy formula. We said fetal autopsies are not included. That's a separate rate. Sometimes physicians, sometimes parents want to understand. It's not clear why a child died, why there was a stillbirth, especially when you're talking about intermediate and late fetal deaths. And so they'll do an autopsy for that. Other times, unfortunately, it's all too evident. For instance, if there's a cord around the neck, those types of things. But when they're done, they're measuring intermediate and late fetal deaths in this formula. And you can look at page 119 for example 7.6. It's toward the bottom of the page, and it'll walk you through how you calculate that. And that is really it for chapter 7. So make sure that you know your formulas, make sure you know what they include, what they don't include, and how to calculate those. And I'll be back to talk to you about week 6 coming up. Take care.